No medicine can remove the cause of a lifestyle disease, but you can. Welcome back to Lifestyle Disease Doctor, where we look at the major chronic diseases and how to reverse them. In this episode 2 of psoriasis, we look at what are the current latest treatment options available in psoriasis. To begin with, the first question to Dr. Jolie is, what are the current options of treatment for psoriasis?
See, basically, the first any disease, lifestyle disease, first line of management is lifestyle. But that has to be done by the patient. When you are for any disease, when you are going to the doctor, you are asking for the medication. So in the psoriasis treatment, the medications can be locally applying medications for reducing the itching and scaling and all, and also the oral medications. Oral medications mainly initially there was only steroids, and now there are so many immunosuppressants and immunomodulators like this. Monoclonal antibodies are available, injections, weekly injection, monthly injection, and that way it is there. And also this anti-cancerous medicine, almost all these immunomodulators also, that is for the immunotherapy in cancer, it's the same medications, which is, many of them are the same medications which is used. And also the anti-cancerous medications like methotrexate, that is anti-metabolite, and also cyclosporine, and many medicines like that is used nowadays. And this next is this PUA therapy, that is it is given for the generally it started with the vitiligo, this hypopigmentation of the skin, and the same ultraviolet rays or the PUA therapy. In PUA therapy, we are using the sunlight's ultra violet rays, or else artificial lighting with high ultraviolet rays, and along with that some medications which will be taken applied on the skin, or also taken orally also, psoralen and such things. That is PUA therapy. And these are the different options that, and also previously the Coltar and all is used, but nowadays I don't think better medications are there. This even the Coltar is having some cancerogenic properties. So, but any of this increasing the ultraviolet rays, PUA therapy, that also actually having damage and the cancer possibilities is that is a problem actually. Basically, anything which is applied can be create problem also, even the injectable and the latest injections also, even the one of the main monoclonal antibody which is used for the psoriasis, it can actually flare up also. Initially it can the suppression may be there. In some patients it can make a flare up, and in this, as I said, it can be used for other things also. I said, no, like if it is using for rheumatoid arthritis, it can make a flare up reaction for the, or flare up or a skin reaction as a psoriasis, it can start itself. And also many of things, this are thyroiditis. It is a very common when you are using such immunomodulators and immunotherapy, that sort of problems also can occur.
As you said, most patients are worried about this long-term use of drugs because they understand that it's like you have to take chronic drugs for a long time. So they are worried about the risk. What is it that we can tell them?
See, every medicine has its own risk also. I don't think there is any medicine which has no side effects. We had to weigh accordingly. That is what is best. Even the most common paracetamol we are using for the pain and fever, that also has side effects. And even it can, in the last doses, it's mainly the liver can be affected, because almost any medicine can have everything is going into the liver, so liver can get affected. Even the methotrexate is very commonly used for the psoriasis patients. It is actually what they are doing. Actually, it is doing the suppressing your bone marrow, your immune system itself, bone marrow. Here, there are the WBCs and all the, not only the WBCs, RBCs and WBCs and platelets, everything is made there. So long-term use of it can go to this bone marrow depression. That is why if the methotrexate is using, you have to check the blood count every week or at least every month. So if it is going down, you have to stop the medicine. And also you have to check for the liver function test. If the liver function test is going up, then this SGOT, STPT going up, you had to stop that medication. So any patient who is using this medication for the psoriatic medications like methotrexate or whatever medication, they should frequently check for the CBC, that is blood cell count, and also this liver function test, and definitely the kidney function test also. In kidney function test, you should ask for the GFR, that is glomerular filtration rate, that is the earliest to reduce, and also microalbuminuria, albumin loss in the urine or RBCs in the urine, or this GFR test if it is abnormal, then you have to either the medication is affecting you or the disease itself is affecting that organs also. So we should be very careful whoever is taking medication. And it is always, when you are in a stable situation, you can come out of by lifestyle correction, you can come out of all the medicines. That is, I'm telling you, it's not just a theory alone. It is actually basically in theory. If you look in the medical literature, there may not be anything like that. What I am telling, this is it's a lifestyle modulation sort of, because everywhere we are thinking about the medications only, the newer and newer medications only. No one is making any study or research into the how the food can, or the changes in the food can affect each and every disease. That is why we are not able to get such a support also. Everyone is, the modern medicine is, or any other medicine situation is the same. We are looking into the medication. So actually your problem is your lifestyle and your body, your food. Your body is basically made of food. So you should, if you look into the problems with that, you can definitely come out of medications, get stable with the medicines, and then come out of medication also, and find out what is the correct way of correct lifestyle for your body. That is very important. It is each person, it will be different also.
Actually, in the world around us, we see that lot of these natural healing mechanisms and creams and all that are heard of in plenty. So, how do psoriatic patients, in what way should they approach such options?
Definitely, natural way of healing has major role in that healing of not only for the psoriasis, for every disease. See, in Mao, where I am residing in Kerala, it's Ayurveda treatment is very famous for all ailments. That is the traditional Indian medicine. So there are so many solutions are there, and what I see is I have experienced the patients who have gone through all these treatments I had met actually as a patient. The problem is when they are staying in the hospital, the Ayurveda, usually they'll be staying in the hospital for 21 days, 28 days, 41 days, and such treatments are there, then it will subside. And when they come out of the hospital and start their normal life, it just slowly started coming up. That is the problem. So that is why, in my approach, what actually I'm teaching, actually it is not just a treatment, it is a teaching program. And understand their body, not only I have to understand, the patient has to understand their body. And making them, enable them, actually our aim is to enable them to understand the body and to live according to the limitations or positiveness of their body, and adjust the lifestyle accordingly. In that way, it is very easy to manage. Not with none of the medicines. I know all this because I am a modern medicine doctor. I am treating these patients. I know that what are the possibility of the medicine, and even though I am giving in the initial stage flare up light medications, definitely I also use. But within a month, I will be able to come out of that. Then after when the patient the human, it is nature now, so they may get into some trouble, mental stress or travel, and then they will teach the patient to how to use medicines judiciously for a short time. If they get not a flare up, it's a mild symptom. If it is developing, then they have to cut short with that itself. Well, you should understand that with a mild itching in the skin, the leg or the ear, so different people will be different sites of exacerbation, and in the starting itself, control it. You are going out of the way from you are deviating from the lifestyle, and control it, and take some light medications for just to stop the itching or the problem, and don't allow for a flare-up.
Actually, how can or when can a patient decide that if they are undergoing this normal conventional treatment of medications and creams and all that, when can they decide that they should look at correcting their lifestyle also?
See, if you are need any medication for more than a week, then you should think what may be the reason. And your medicine you are using for a skin problem, you are using a medicine, and it is going, and after some time it is coming again, and it's going and coming after the medication is stopped. That means there is a problem internally. Your immune system, whatever is the disease, your immune system is the protective, not only the skin, every aspect. That the immune system or the metabolism. Your metabolism is also controlled by the immune system. So your metabolism or the immune system is out of balance actually. So you have to take it back to normality. So how you can do it? It is, you cannot correct the immune system with the medication. You can suppress the immune system with the medication. You can, with vaccination, you can give a protection or the stimulate for a particular infection. Or with the antibiotic, you can suppress this or kill this bacteria or virus, or the growth can be suppressed. But you cannot balance the immune system with medicines. You can support the immune system with the medication, but long term, immediate use, you can use all these measures, whatever is available, and then find out, give time and find out, understand, and come out of it, and correct your lifestyle, then come out of it. Then they learn how to live with your limitations. The disease is a limitation for the patient, that's all. So if you want to understand that the lifestyle limitations, you will be able to come out of it.
Actually, for these latest treatments, we hear these biologics and all that. So those who are thinking or planning for that, what is it that such patients should know about?
Biologics actually in the third level medicines. Actually, the first level of medication is this applying on the steroids and the Coltar and such things. Next is the PUA therapy and this ultrasound, this ultraviolet rays therapy. And the third level of treatment is the methotrexate, high-level immunosuppressants like cyclophosphamide or this anti-protein inhibitors sort of things are there, and also the monoclonal antibodies that is actually as an injection, and they'll be costly also. But many of the nowadays in many of the places the treatment is fully this insurance covered. In such cases, the cost may not be a factor for many of the patients, but we should understand that the cost may not be a factor, but your these monoclonal antibodies and all these immunosuppressants are making your modulating or different ways your immune system will be affected. You may get a relief in the skin, but after within 3 or 6 or 7 months, you may get a thyroiditis or other systems start affecting. So that is the problem. So whatever is what you have to do is get yourself comfortable with the medication. You definitely, for psoriasis patients, the medication is effective. Within 2-3 weeks, there will be definite relief will be there. And after that, you concentrate on your lifestyle, but you may not be able to do it yourself. That is the problem. And there are not many doctors who is available for the treatment also. I don't know anything like what I am giving, this clinically sort of support, this coming out of this lifestyle disease with clinical support. I don't think that there is anyone. I don't know exactly, but in my premises or anywhere, I have not seen in the website or anything, or the internet or anything. This sort of approach I had never seen. Actually, one of my patient last day, they're calling from one of the Western countries like Canada or US, and he was asking me, he has to come over here, or whether I can give advice. I can give advice, but it is not sufficient actually. A person, if you want to take a clinically supported lifestyle correction with what I'm doing is at a cellular level. We call it as a cell activation protocol. It's a protocol actually. It has to learn initially. So you cannot teach them by the digitally by this method. They have to come and first out you have to work out. And he is also asking me. I'm asking the doctors here and asking for this test, this allergy test, and for the to find out my ideal food. They are not allowing me to do it. Actually, he's telling. So that is because it is not commonly accepted in the modern medical practice. Also, the psoriasis or any other autoimmune disease. If you are looking, want to look into the food and lifestyle, generally there will be a saying that you have to take regular exercise and get good sleep and avoid this alcohol, smoking, and such things. They're always every major hospital website or the NIH websites will be advising that. But never in a specific form of looking into the, for the allergy, there will be allergy tests will be there. But this should be, you had to go into not only the allergy oriented, intolerance and other available tests also. This, when it is available tests are there, then it will be easy to find out which is. Otherwise, we had to, every items we had to take it and see whether it is and then avoid it. That's when I started practicing this clinically supported lifestyle correction, only this allergy test or IgE mediated test were available. Now even the other mediation like IgG mediated tests and all is available. That is giving more convenience actually. Before also we were able to manage the patient, but it will be more easier for more of this knowledge oriented test along about the food and the environmental factors available. It is easy to support the patient actually.
You were mentioning that there are different levels of treating psoriasis in the conventional treatment approach, and in the third level is what these biologicals and all come. So, if a patient who is taking such biologicals, in your experience, can those patients also benefit from lifestyle correction? And,
Yes, definitely. Most of my patients are already on this methotrexate, and they may not be. Usually, the first line of oral medicines will be steroids, like a prednisolone and all. Defac, here I've seen prescription like Defac or prednisolone. And next is will be methotrexate. And next, this tofastinib sort of medicines will be there. That is that is also this immunomodulator group of medicine. And next will be this monoclonal antibodies. That the names are very difficult, so I don't want to pronounce it. So all sort of patients I'm seeing, and all of them can come out of medications within in a month. Most of them, if less medicines, within a month. And methotrexate, and I have seen patients with the 15 milligram, 20 milligram. It's a small tablet every week only they're taking. So it's very cheap, it's very economical medication. So no one will be thinking about it's too hard about that. It's a simple thing, you can take it. But actually, if you're taking such medicines, you should, as one thing, you had to check at least every month, you had to check your blood, the blood count, and also the liver function test, and also the kidney function test. If anything is going abnormal also, you have to be careful, and it is time to stop. That is, it can create problem. So you cannot simply stop the medication for the psoriasis. Even the steroids, if you stop at a moment, it can give a flare-up reaction actually. So never stop the medications just because it is having side effect. Just if you follow the, I cannot say that you can go to. So usually the modern medical doctors are this skin specialist or the rheumatologist. What I'm saying is here it is usually the rheumatologist will be giving this sort of medication that the patient in our part of the country. This sort of things are usually treated by the rheumatologist, and the specialized prescription like this monoclonal antibodies are given by the rheumatologist. So those who are come to me and that following, and they are all able to come out of the medication, and they were able to manage the smile. If it is when everything is over, this skin lesions are over, then you can follow this diet also. When they are adjusted with the diet, that is possible within 3 months for almost all the patients. Only if they neglect their lifestyle completely and they support the skin applications. It's all in the nutritional based actually. If they completely ignore that, then they can get a don't go for a flare up and all. If the modern medicines like steroids is started, immediately there can within weeks you can get a flare up also. So there is a method to here also. We'll be withdrawing the medicines one by one, and in a time period, and following with the symptomatic relief and also blood reports also. With the blood report improving and the symptomatic improving, each medicines are reducing the dose and then finally come out of it. That how within how much time it can be out of the medicines depends on how much medicine they are using. So within 3 months, I had seen almost everyone, and many of them will be out of the medicine within a month itself.
Actually, if you have to give a message to patients who are frustrated with treatment, and frustrated with their psoriasis and the treatment, and who are worried about continuing on more and more serious medication, what will be your message?
Basically, what the patients should understand that it is a lifestyle disease. No medicine or injection or surgery or anything like that can't cure a lifestyle disease. That is what happened in the psoriasis treatment also. We are going for more and more medicines, and all the medicines will be having, all the medicines which is used for the psoriatic treatment is immunomodulators or some way or other way immunosuppressants, because it is an autoimmune disease. It's an overactivity of the immune system. So trying to suppress it. So that is not an answer. So if you look into the best hospital or anywhere in the world, like Mayo Clinic or wherever you are looking also, this sort of medications, this step upping type of medication will be there, like this local applicant, then PUA therapy and all. That the last grade will be the metabolite, anti-metabolite, methotrexate, and this immunological therapy. So that is the last, because they are having that. That also will be definitely written in that. It is the more side effects can occur. Don't think that if the latest treatment will be having more costly, but it also it doesn't mean that the costly medicine doesn't mean that the side effect is less, because the latest medicines will be the costlier, and the research also, or the experience with the treating with the medication also may not be sufficient. There are so many medicines which will be coming for 1 or 2 years in the market, then that is banned and or withdrawn from the market, and it is all common. That is because by withdrawn from the market means there is so much of unacceptable side effects. That is the reason. So understand that you can come out of this medication, and that is the positive thing. You should understand that you understand how to correct the lifestyle. It's a lifestyle disease. Only thing you have to understand how to correct it. For that, you may need support, and how you get the support and how can you arrange the support, that is the matter actually.
Actually, we come to the conclusion of this episode. In the next episode, we will be looking at the comorbidities and complications associated with psoriasis, because most often psoriatic patients will be having other associated diseases and disorders. So join us again with us with the lifestyle disease doctor in our next episode. Thank you.